Around 15 to 18% of any population in the world is infertile. 1 in every 5 couples face some sort of infertility. Unfortunately, this percentage is increasing since a few years due to hectic lifestyles, professional careers overshadowing personal lives, late marriages, delayed pregnancies, stress-filled jobs, etc. The problem could be with the husband or wife or both, but more often than not, a biased conclusion is taken against the woman.
Appropriate treatment at an appropriate time with precision is a key to success. Hence, success rate for assisted reproductive techniques depends on the skill and expertise of infertility specialists and embryologists who can execute their job with precision. MOMSOON Fertility and IVF Center at Bangalore has one of the best embryologists, Dr. Ravindranath, and equally brilliant infertility specialist, Dr. Santosh and Dr. Sabita.
Dr. Y. Ravindranath, PhD, Human Genetics, Senior Embryologist and Scientific Director, is a specialist with over 18 years of experience in the field of reproductive medicine. Dr. Ravindranath is the first Indian trained in ICSI, intracytoplasmic sperm injection, in 1994-95 at the Catholic University Leuven and Genk, Belgium, which has a reputation of being the best in the world for ICSI and assisted reproductive medicine. Trained in advanced ICSI techniques at the Institute d'Art, Naples, Italy, under Professor Brian Dale. Trained in sperm and embryo cryopreservation at Bourne Hall Clinic, Cambridge, UK, which produced the world's first IVF baby, Louis Brown, the first Indian to learn pre-implantation genetic diagnosis, PGD, at the University College of London under Professor Joyce Harper. Trained in embryo-assisted hatching and embryo biopsy at Jones Institute of Reproductive Medicine, Norfolk, Virginia, USA, which produced the first American IVF baby. Dr. Ravindranath has established the first IVF laboratory in Riyadh, Saudi Arabia and Kuwait. He has been instrumental in overseeing the birth of the first IVF babies in those countries, as well as the first IVF babies of Hyderabad, Mangalore and Mysore. He is the lead faculty and the course director for the postgraduate diploma in embryology and assisted reproductive technology started by MOMSOON in collaboration with the Bangalore University and approved by the University Grants Commission.
In India, infertility is neither practiced nor taught adequately in our medical colleges, even at the MD level. There is hardly any research in our country. We have to depend largely on the Western data to achieve best possible results in our country. The success rate in this assisted reproductive technology revolves around 30 to 35% throughout the world. We also have the same percentage of pregnancies, but the abortion rate is quite higher in our country. To achieve this goal, we need to work very scientifically and methodically to achieve the best possible results. MOMSOON Fertility and IVF Center is geared up to meet this challenge with adequate knowledge and knowledge base.
When a couple fails to conceive in a span of 12 months of active married life without using any contraception, it is time to meet an infertility specialist without any more delay. When the couple meets the infertility specialist would be able to diagnose the problem after thorough counseling and investigations. Then the line of treatment would be decided, be it a simple medication or an IUI procedure or an advanced techniques like IVF or ICSI, commonly called as the test tube baby. In any case, before starting the treatment, it is important to look into the issues of severe abdominal pain during periods or excess body weight or higher insulin values, which indicates towards endometriosis or a PCOD. In assisted reproductive technique, the results are good if these basic parameters are corrected and found to be okay.
IVF was originally designed for couples having tubal factor infertility, but in today's scenario, it has extended applications like male factor infertility, severe endometriosis, advanced maternal age, and when couple fails to achieve pregnancy by other means. IVF is a procedure which has to be monitored at all steps. It is popularly known as test tube baby. Surprisingly, there are no test tubes used here. IVF means in vitro fertilization. That means sperms and egg are fertilized outside the body. It has 4 more important components. First, ovarian stimulation, in which female partner is stimulated with daily gonadotropin injections in higher dose so that she produces more eggs to get more number of embryos. Egg retrieval is done transvaginally using ultrasound with the ovum pickup needle. Eggs retrieved are then fertilized with husband's sperm either by IVF or by ICSI. Embryos are cultured for 2 to 5 days and best selected embryos are transferred back into female partner's uterus. Entire IVF procedure should be individualized and should be monitored by your consultant so that we get best quality embryos, best embryos and good pregnancy outcome. IVF needs expertise at various levels so that the doctor whom you are seeing should have expertise in ovarian stimulation protocol, embryo transfer technique, and it should be done safely. In the whole process, right from counseling to embryo transfer, your doctor should monitor IVF at all stages and should have expertise at all levels.
My name is Sharad Babu and my wife's name is E. Ratna. Actually, we are from Ballari. Actually, I was working in Ballari and I went for many hospitals where doctors said that it is not possible for you. Why? Because there is a problem with your wife, some tube. So later on I collected data in Ballari from doctors. So what can we do regarding this to have a child? And they said me to go for Bangalore, and there are many IVF hospitals in Bangalore. You can consult them. So after thoroughly going with the internet, I came across MOMSOON Hospital where I called to Mr. Ramakrishna, telephoned him and contacted with him later on and discussed with him regarding the issue, and he said me to go across some other hospitals also. So wherever you go, you can't get as least fee with us. So I consulted many hospitals also, where I came across it was too high. So later on I thought to go with the MOMSOON itself, and I consulted, but our fate was very good. We got some good people here. So Dr. Ravindra sir and Lady Dr. Savita Girish and the team. So we came here and we got first cycle, and it was a failure, and again we got another cycle, so where we have succeeded. And at the same time, so during this span of time, it is nearly about 1 year to go across 2 cycles. The nature of the hospital was such that I never thought that we are going for an hospital. It was just going to our neighbor's house or some friend's house. Why? Because the team of MOMSOON was very well. They used to take very well care regarding the patient. Not only me, every patient.
हमारे 7 साल से बच्चे नहीं थे। मैं 7 साल से बहुत अकेली महसूस कर रही थी, क्योंकि बिना बच्चे के किसी के घर में भी कोई खुशी नहीं रहती। बच्चे बहुत मायने रखते हैं एक औरत के लिए। इस वजह से जब मैं मॉनसून हॉस्पिटल आई, उसके बाद अब बच्चे होने के बाद बहुत खुशी महसूस कर रही हूँ। माँ बनने के बाद बहुत खुश महसूस कर रही हूँ। हॉस्पिटल बहुत ही अच्छा है। यहाँ के स्टाफ, डॉक्टर्स और जितने भी यहाँ के लोग हैं, उनका बिहेवियर है बहुत ही अच्छा है। हमें कभी महसूस नहीं हुआ कि हम कोई हॉस्पिटल आए हुए हैं। हॉस्पिटल में जैसा हमको ट्रीट करते हैं बहुत ही अच्छा, ऐसा लगता नहीं कि हम कोई हॉस्पिटल आए हुए हैं। और मैं सभी लोगों से, जिसके भी बच्चे नहीं हैं, उनसे यही मैं कहना चाहूँगी कि ये हॉस्पिटल नॉर्मल हम जैसे लोगों के लिए बहुत ही अच्छा है। मैं बहुत खुश हूँ IVF सेंटर से, मॉमसून हॉस्पिटल से, और यहाँ के लोगों को सभी को मैं धन्यवाद देना चाहती हूँ।